Simulations and educational games are a big part of what we do at iheed. We develop apps at different levels of complexity, from small-scale articulate storyline interactions to more complex apps like the interactive comic book, where each choice leads to a different story unfolding. The most elaborate apps we develop are medical simulations. We have over 30 realistic clinical patient scenarios for doctors to work through. They touch upon common and not so common presentations in the emergency department and family medicine practices. To succeed, a student needs excellent patient communication skills, a working knowledge of anatomy, pathology, test interpretation, and pharmacology. Students tell us simulations are a great way to apply reasoning skills and solidify the material they have been studying. The app has access to our own up-to-date database of drug treatment and diagnosis definitions with fuzzy search functionality. At the end of the scenario, the simulation can report back the overall score to the learning management system. This allows the iheed tutors monitor how well students are performing and intervene if necessary. The student can also try again for mastery and now has access to extensive in-game advice content. We use third-party authoring tools to help us generate content and game assets to speed up the authoring process. For branching scenarios like the history-taking section in the simulation game, we use Draw.io to map out the branching logic. We style cells according to actor type and whether they contain clues which determine the score. We then export the Draw.io branching data as XML and import into the game repo. Our JavaScript branching XML interpreter renders the history-taking section. Similar to our content authoring tool, we use Storyblock Headless CMS to generate scenario data. The simulation engine can then deploy the scenario as either an industry standard e-learning scoring package or as a hosted learning tool application that communicates to the LMS via secure API.